Hello, everyone. Welcome to another MedFit Education Foundation webinar. Today, we have with us Christine Conti, and her topic is Thriving with Arthritis, Create an Action Plan for Life. Christine is the 2023 Fitness Instructor of the Year Award winner, and she's CEO of FitFix Now, CEO of Conti Fit, COO of Reinventing the Woman International. She's also co-host of the Two Fit Crazies in a Microphone podcast, and she's author of the book Split Second Courage. She's a four-time Ironman athlete, a 100-mile running race finisher, and has completed over 50 marathons. And she guides Special Olympics athletes in triathlons. Since receiving a life-changing diagnosis, she's turned from an investment banker career into a fitness career where she believes anything is possible. And she's also author of our Arthritis Fitness Specialist course. And I'm going to turn off my mic and camera and let Christine have the stage, and she'll do her thing.
All right, thank you so much, Jonathan, for that wonderful introduction. And I just want to say hello to everyone. Welcome, everyone that's listening, whether you are live or whether this is the recording. Thank you for being proactive about thriving with arthritis. And this presentation is not just about how do I help my clients. This is about how do you help yourself. Because at some point in your life, I hope you all live long, healthy lifestyles, that arthritis is something that is natural. It occurs. And, it can be osteoarthritis. It's a breakdown of the joints, right? And that synovial fluid, as we get older, it gets like gunky, right? We can't just give ourselves oil changes like we do with our car. It's about movement, and it's about health and wellness at a larger picture. So when we think of creating an action plan for life, an action plan is not something that I can say, y'all just do this and follow it. It is very individual to everybody because everybody is different, right? So we're going to take some time today, and I want to share with you some of what I've learned in the last few decades. And I'm actually going to share with you what I've been working on, which I don't think anyone else knows about, in the last 2 years with regards to arthritis and movement and creating action plans for life. So my name is Christine Conti, and one thing that I'm super passionate about is movement. And I truly believe that the second you stop moving, it's all over. And it sounds really harsh. It does. And I'm going to rip the Band-Aid off even before we start. So I get it. Your back hurts. All right, we're going to rest. How long are we resting? Okay, is this from a surgery? Is it an injury? Are we recovering? Or are we just chronically using these pains as a crutch to not do something? And these are the things as a fitness professional, as a trainer working in the medical fitness world, that it's a fine line that you have to have these conversations with people of what are your options, what are your choices? Are we going to remain sedentary, or are we going to attempt to move? And it doesn't have to be crazy. You don't have to be running marathons. You don't have to be swimming the Atlantic Ocean to be moving. And that's what we're going to talk about today. And we're going to get real. We're going to get very real because in the last 2 years, I've been out in the field, let's just say, interviewing over 500 people about how they feel and what they do and what they're willing to do and what they know about movement and know about exercise, and how do we even make a dent in that? How do we make a ripple effect in changing the perception of having something like arthritis and implementing an action plan to help maintain or reduce symptoms? So very first thing we're going to do right now. Okay, very first thing, and I hope you can see me. We are going to stand up. If you are able right now, you're going to stand up, or you're going to sit up if that's what you need to do. And you're going to do this with me because this is interactive. You're not just going to sit there, okay? So I need you to go ahead right now. Put your shoulders back, chest is lifted, abdominals engaged. Okay? What in the heck is she talking about? I know, Christine, stand up straight. No, no, no. No, I need you to do this. Shoulders back, chest is lifted, abdominals engaged. This is the very first thing when we talk about creating an action plan. I need you to stand here for a moment. Go ahead and squeeze those shoulder blades down and back, right? Squeeze them together. I want you to engage the core. Just squeeze it just a little bit. You're breathing, right? Good. I want you to notice right now what's happening. Those muscles are igniting. Okay, and I need you to think, to picture and imagine all those organs in your stomach right now. All the organs. Maybe we go from the heart down. Okay. When we stand up, what is happening to our organs? Do they have plenty of room? Do they have lots of room to work optimally? They do. What happens when we slouch? We are squishing our organs, all right? We are reducing circulation, blood flow. This is what I need you to think about. Because right now, when we talk about an action plan for arthritis or any sort of chronic pain, it starts with posture. How are you holding your body? Because I want you to look around right now. If you're by yourself, you're only working on you. But look around. Look at the people you work with, your clients. Are they like this? All right, do they have kyphosis? Right? Are they down here? Everything's pulling forward. Their pectoral muscles are super tight, right? Because their head is having all of this extra pressure. You know this. You're professionals. You get it. But why aren't we starting with this every single time we work with somebody? The power of posture is unbelievable. So this is it. I'm hoping you're still like this. You're going to notice now, maybe you're getting a little tired in your upper back. Ooh, what's going on with the traps? Wow, okay. So this is it. This is where we start. When I talk to people, the first thing I do is I look at them and say, shoulders back, chest is lifted, abs in tight. Shoulders back, chest is lifted, abdominals, just engage them. Because automatically you're going to pull your head up. And you know what that does? Changes your perspective a little bit. Because think about it. We're looking down. This is a very negative mindset. Our energy is coming down. We're up here. That energy is coming out. That is where we start. So we're going on right now because what I want to tell you is a little bit about what I have learned. And in the last 2 years, why I tell you this is because I've actually been traveling quite extensively. And I had a chance, I was very grateful, to go and work and present and speak and interview with employees, teachers, professors from 20 different companies or institutions. Over 500 employees have I individually spoken with. And some of the samples that I wanted to share with you, a company, Estes is trucking. These are people that tend to be sedentary. They sit all the time. Care First is another one. A lot of people that are sitting at desks. Tidal Health is another one, desks. Boston Medical Center, I've been talking with a lot of nurses and doctors and surgeons and to kind of look at them, city governments, New Jersey Transit, that's Johns Hopkins University, school districts, literally from these different walks of life, people that are working on their feet all the time, people are sitting all the time, very high stress. And what's very interesting is that I asked them, what type of exercise do you do each week? Without judgment, what type of exercise? So this is what they told me. Walking, light weights, and stretching. That's what they said. Okay. Now, I know what you're thinking. That sounds great, right? Okay, walking is the best thing you could possibly do. Light weights. Okay, you're moving. Stretching. Now, here's the issue. What I want to tell you is this. So when we think of exercise, when we think of getting older, right? I'm sorry, I'm going to say it, arthritis. Some of the things we need to do is a lot with mobility, right? If you're not using your shoulders and using those muscles and the stabilizing muscles and all of it, what's going to happen? They atrophy. You lose the range of motion. And while it's great to stretch as much as we can, what are we doing to strengthen? Light weights, okay. But when I asked them about, well, what type of light weights, they would say about 5-pound weights. Interesting, because when I think of light weights, that's great, but how much is that car seat that you're picking up, or your grandchild that you're picking up, or you're moving a garbage bag, or I started to see patterns. And when I asked them about how much walking, they would say a couple times a week. And I would say, does your heart rate get up? Well, not super high. I mean, I'm not sweating, right? So these are the things that, talking to these people, I started realizing that there's this misconception about what exercise is and what I should be doing. And most of the time, when I talk to these people, they would say, I can't lift weights because it would hurt my wrists, or it's going to be bad for my elbow, or I've got pain because I have back pain because I'm sitting, and a bulge just because of this, and it would go on and on and on about these comorbidities, and I would literally just sit and listen and take notes. And I got to a point where, with arthritis especially, was, what are your choices? Are your choices to not do anything? Or is your choice to get up and move? Are you going to make things terribly worse by lifting a little heavier? What is that fine line that we're walking along? And that is what really struck me. And I have to tell you, I'm on location today, okay? I'm on location at a company, and I just spent the last few hours talking with people, and they come up and they say, Christine, I'd love to work out, but my arthritis, it bothers my hip and I said, well, what do you currently do? Well, I don't do anything because it's kind of a little, I said, okay, there's problem one. What did I say at the very beginning? The second you stop moving, it's all over. So what do we need to do? Muscles like to work, right? Bones, they want to build. What happens as we get older, right? We're 70 years old, and what's happened to our muscle? It's like 60% less than it was. What do we need to do? We need to add weight. We need to stress those muscles. We need to build that bone. And when we think about it, people are like, well, but two choices here. And it's a lot of back injuries, hip, knee replacements. And we talk about holding on to that extra 50 to 100 pounds of weight that is stressing our joints. This is what we need to start educating people about. So when we create an action plan for life, and this is why I tell you this, because I get all these excuses, and I say to people, what's your excuse? Well, okay, action plan. What I realized is that many of us are starting with exercises and these ideas that are not even in the same universe as what people think they should be doing. Not even the same universe. Someone told me today, well, they stretch a couple times a week. That's their exercise. What are we doing for our heart? What are we doing for the cardiovascular system? There's so many things. You can go in all these directions, but that's not what people are ready for. We're ready for the start of an action plan that was going to keep them healthy and moving and independent for as many years as humanly possible. So this is what I've learned. I get all of these excuses, right, to the action plan. I start with the problem, then we talk about the solution. So this is the problem of what I've learned with people with arthritis. Okay, and when I talk about arthritis, that is osteoarthritis, that is arthritis, from injuries, overuse, all the way to autoimmune. So it could be your rheumatoid arthritis, your psoriatic, okay, all the way to a lupus, you name it, all right? So any sort of autoimmune disease, a lot of them have, really overlaps. So you're going to see the same, whether it's swelling or tenderness, soreness. But this is what I learned. Sedentary lifestyles, these are the excuses. No time, no extra money or funds, back pain, poor posture, obesity, lots of comorbidities, multiple pain medications or medicines that they're on, chronic physical pain, and then the other one was they're defensive. Well, I can't lift. I'm not going to lift. My doctor told me not to lift. But then, really interesting. So what have I really learned by all of this, by talking to people, is that it starts with the mind. They have poor mental health. You don't become 200 pounds overweight because you're hungry, right? Most people, I will tell you right now, you don't just have poor posture because that's what you want. Okay? You're not on multiple pain medications because you're not in pain for various reasons. No time. What does that say about what you're prioritizing in life? Why don't you have time? Why are you sitting all the time? Well, because I think of, are you living or are you existing? Because if you're living, you're out doing things, you're interacting, you're going places, you're seeing new things, new experiences. Sedentary means you're just sitting around. Or maybe that is your job, to sit, but where's the movement after that? Are you filling your life with just sitting in front of a television or sitting in front of food at a table? These are things that I really sat down for a long time and thought about. As a fitness professional, we're dealing with people with arthritis, and it's more than just, I need you to lift a little heavier. I need you to, it starts with mindset. Number one, that is the biggest takeaway, that poor mental health. And what I want you to think about right now, and we're going to get into some practical stuff, is that yes, living with arthritis is difficult. You've got chronic pain. Have you ever experienced chronic pain? That's for like a week or more, right? I mean, you might have a really bad headache and you can't even function. That's what chronic pain's about. It disrupts your ability to think, to perform tasks, to operate on a level that is quality of life. So what we're going to do is talk about the mental health, nutrition, and exercise, not just living with arthritis, but thriving with it. I want you to live. So let's talk about some do-it-yourself strategies. And I love to say that if this is you, I hope you take away something that's going to help you. Because here's the reality, right? We've got an estimated 50 million Americans, daily joint pain discomfort, 86 or 8.6 million concomitantly with lower back. Now, I was just on a webinar with Dr. Herb Rubenstein, and we were talking about, orthopedic issues and whatnot. And some of this is very, relevant. So we've got, take a look at this, compromised ability to perform activities of daily life. Because what happens? The weakened muscles and bones, decreased mobility and stability, your strength goes down. And what's happening? You know this, the pharmaceutical agents, right? It's a temporary solution. It's lipstick on a pig, right? It's a Band-Aid on a, chainsaw injury. There's potential side effects that are harmful. I don't want you to be on biological drugs at a high dose of methotrexate or the chemo that they give you for arthritis sometimes, especially autoimmunes, because there are such crazy side effects. You listen to those infomercials, they're everywhere, right? You know what the last one normally is of the side effect? Yeah, it's death, okay? Normally there's like a blah, 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 liver, this, that, blah, 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 death. I'm like, whoa, okay. Yeah, how do I not get death, all right, from this medication? Well, I am 100% for Western medicine. I love working with doctors and the medical profession, but I also want you to think about what we can be doing and how to educate. So many people with arthritis, I was speaking to a woman today and she said, Christine, I have arthritis in my elbow and my shoulder. My doctor told me just give it a rest. Don't do anything with it. And I said to her, I said, it hurts me to hear that. I said, because the worst thing you can do is nothing. And then I had her think about things that she does throughout her day. I said, okay, let's just say you're not going to lift at all, right? You're not going to use weights. Great, fine. What are you doing for mobility? And she said, well, what do you mean? I said, well, do you have cabinets in your house? And she said, yes. And I said, do you ever reach for glass? Yes. I said, what if you decided you weren't going to move that arm anymore? Could you reach for the glass? Could you open the door? Could you touch your head? And I said, I really want you to think about, write it down even. Write down all the things you do that you need that shoulder mobility. You don't need 50 pounds, but are you willing to give up those things? That's what I want you to think about. That false belief, it's going to make it work. Well, if it's that bad and that terrible, some people get surgery, right? But what is it that we're doing to keep that synovial fluid going, right? To get all those stabilizing muscles. That's what I want you to think about. And that's what I want you to have your clients do. Write down what they do. Have them tell you, what do they do to use that? And what I came up with, and I really love, is a 3-prong approach to reduce symptoms of arthritis, along with the medical advice, right? That is crucial, to have that conversation of what you're doing, what medications, what the side effects, and knowing what's going on. This is crucial to the long health span. You can't just take a pill. I'm sorry. You all are very educated. You know this. But here's the why. We need higher level of educated fitness pros. Honestly, if someone has arthritis, you want to know, if they come to you, you know what's going on with their joints. You know that if they have terrible arthritis in their hands, that you're going to give them bands to go around their wrists. You can do something else if they have shoulder issues, maybe leaning against a wall or a counter, so that they can control their body weight. That's what we need. Because right now, the average trainer, and I am all for certifications, I want you to get all the education. I need you to think about going farther. Yes, of course. I'm the author of the Arthritis Fitness certification. Yes, but I want you to think about, what are you out there reading? What are you out there learning right now? Are you reading articles? Are you following? I follow a great email campaign where every day I get a new little arthritis article that comes out about what new medications are out there, what's going on with different foods, what's the latest research on, what's happening with nodules. There it is. Just something new so that you stay up on the conversation, so you can have that higher level conversation with your client. So 3-prong approach is what we're going to look at, and I want to educate you and support not just the physical but emotional. So here's the 3-prong approach. You might look at this and say, oh, this seems really simple. You're right. You are absolutely right. This is so basic, and guess what? Sometimes y'all know what to do, right? But we don't always do it. Think about that. All right. If you right now have a piece of paper and a pen, go get it. Go get it. Because this is a great chance for you to reflect on you. You personally, you as a fitness or medical professional, about how you talk and treat and work with your clients. So the 3-prong approach, notice the bottom, in this order. Okay, can we repeat after me? In this order. Mental health mindset, nutrition is your fuel, your exercise as your movement. That is the key. So you don't have to be a doctor, you don't have to be a nutritionist to follow this 3-prong approach. So number 1, mental health matters. You know this, I know this, but here's what's really important. Many of you have heard this story, and I've told it. I'm going to give you a super short version of this. Christine, why? Why do you talk about arthritis? Why are you so passionate about this? I will tell you right now. Age 30, I was diagnosed with a very aggressive form of rheumatoid arthritis. Left my maternal grandmother in a wheelchair, paralyzed. She was a quadriplegic. Never saw her walk. She died when I was 10. My mom was the main caretaker. Now, when I got diagnosed, I thought it was a death sentence. I went into about a 6 month period of depression, of questioning, of not wanting to live, because I thought that my body was going to just give out. And when I did all my research on arthritis and realized, wow, arthritis, it doesn't just affect the joints, it affects your internal organs. And, it goes much farther, that it scared me. And that is when I did the research of what can I do? What can I do to hold off these symptoms for as long as possible, knowing that this is there? I can't do anything about it. I can't push it away, but what can I do? I tell you this because when someone comes to you and they have arthritis, part of them, and they believe this, part of them feels like they died. And after, again, research and I know with what I went through as well, um, it's like the stages of grief. And I need you to really understand this when you work with a client who has been diagnosed with anything. They could be diagnosed with arthritis in their wrist. They could be diagnosed with a, severe autoimmune disease. Whatever it is, it's important and it's big to them. Maybe you're like, oh, whatever, it's fine. To them, it's the world. To them, it means they can't do fill in the blank what they used to do. They can't run like they used to. They can't throw the ball like they used to. They can't lift up the garbage like they used to. Whatever. You have to understand that this is really important for you to address. You don't have to understand, because guess what? You don't have to have empathy. Like you have empathy, but you may not understand exactly how they feel at that moment. And that's okay. You don't have to have a disease in order to work with someone with a disease. But I need you, the very first thing to do is identify where are they in this stage. So if someone comes to you and they have arthritis or they've been diagnosed with an autoimmune, that's number one, is that they're there. Okay, they're there, they want it, that's a huge step. But wait, what you may get are people that by a family member, or maybe they're forced to go. Are they open to trying new things? Are they open to a new exercise? Are they open to talking to you? This is first, because some of those people you get, maybe they're there, but are they existing or are they living? We have to figure it out. Are they open to your help? Why or why not? Having that conversation is really important. The how, the feelings, I know. I grew up as an athlete. You didn't talk about your feelings, you just did, okay? But this is important. Hey, how does it make you feel how did it make you feel when you got diagnosed? Or how do you feel right now with your wrist not being able to use it for whatever? Maybe they played the piano and they can't use their hands anymore. That was a big part of their life. Talk to them about this. Ask them how they feel about it. What else can we do? Real life situations is what you want to talk about. And the how, I wrote down storytelling because as I just demonstrated for you, I tell my story. Hey, yeah, you know what? I was diagnosed and this is what I went through, and I had support and I started exercising, and some days are good and some days are bad. And I realized, I couldn't hold weights anymore. So I had to find a different way to do it with bands. And this is important. It doesn't have to be you. Tell a story of someone else. Heck, tell my story. Whatever that may be, whatever you find, storytelling is powerful, because emotion, I'm going to say this, my good friend and amazing person, Jonathan, can fill in the blank right now. Emotion drives motion. I had to give you the shout out. I'm sorry. It was applicable. But that's really important that you have this emotional tie to what you want to do, right? Emotion drives motion. I will never forget that. I think it's so important for us to keep remembering this, because actually this webinar is going on in May right now, and May is Mental Health Awareness Month. So what can we do? Practice problem solving, right? Hey, how you feeling? What's been working? You're getting frustrated because you can't hold your utensils anymore or whatnot. What can we do to make this work? Are you breathing with people? This is this should be done at the beginning and end of every single session. Just like I said, right? I'm gonna have everyone right now again, if you can, either stand up or sit up, shoulders back, chest is lifted, abs in tight. Did you notice that you dropped your posture because I didn't remind you before? Just like you do that, the very first thing every time you're with a client, take a breath. Take a breath. We're going to practice this in a moment. I'm going to take you through a little segment. But are you breathing? Inhale. Exhale. Box breathing, right? Belly breathing. What are we doing to get that circulation going through those organs? Because now that we're standing up, I now need you to get everything moving. Visual and guided imagery. If they're not in a good place, right? Can we do some guided imagery if I want you to close your eyes and imagine something that brings you joy, something that makes you happy, something you love. I want you to breathe it. I want you to taste it. I want you to think you're touching it, see it, and breathe it in. Exhale, let everything else go that's not serving you. Wow, just a couple seconds of that. And I tell you this because this is the action plan. These are things that people will actually do when you're not there. I said it. I said it. You can give people all these different programs and this and that. And what I have learned is that many people don't do it. I wish I was lying, but I'm not. But you know what they say they do? Hey, Christine, you know what? I do those breaths sometimes. Hey, Christine, I always hear your voice in my head. Shoulders back, chest is lifted, abs engaged. They remember that. They remember, oh, let me take a deep breath in and breathe in all the good. Exhale anything not serving me. That they will do. That is where we start. And when I said this three-prong approach starts with mental health and mindset in that order, this is where it starts every single time. And then, of course, introducing, hey, have you ever heard of tapping? Do you ever use affirmations like, yes, you can? Do you ever use gratitude? Like, I'm so happy my hands work for me today. I do this all the time. I stretch with someone and I have them, maybe they're using their leg and I say, tell your leg, thank you for working for me today. And people giggle and laugh. That's gratitude. Easy form of gratitude. What are we doing? We are conditioning our mind right now. Now, I can get into all the psychology of all this, but this is classic conditioning. Convincing that mind of the yes, you can, of we are going to move. We got this. Because what we're trying to do is safe routines. That's it. Developing a routine. What is it that you do for yourself, for your clients, that make them feel I can do this? If you start with posture every time, that's a routine. Take a deep breath, routine. Okay, whatever, maybe a stretch, maybe a guided imagery. Maybe they only get that at the very end when they take some deep breaths and release. That routine puts them in a state of mind, lighting up a little bit of their parasympathetic nervous system, right? Puts them in a little bit more relaxed state, get rid of some excess stressors, lets them be more open to whatever it is that you are going to suggest that they do. All right, I'm going to get back to that in a minute. After we've gotten this mindset, we've talked to them. Where are you at? Are you angry at what's going on? Are you willing to do some things? You can, and I've got some info for you in a minute, but there's so many different ideas out there. Oh, you've got arthritis. Oh, I should eat this, eat that, eat this, do this, the turmeric, the water, okay. Woo! Okay, that's it. I said in this order, mindset, nutrition comes second. Whew. Nutrition matters. This is not a new topic, I'm telling you right now. Nutrition affects inflammation. This is the nutrition is medicine theory. This is not new, okay? You cannot out-exercise a bad diet. You cannot take away inflammation using a pill if your diet is going to be awful all the time. It's not going to work. Whole foods, they're underrated. It's so simple, yet so difficult. We talked about it before. 1, 2, 3. Second, whole foods. I do not have to be a registered dietitian when I work with my clients with arthritis and they write down what they had, and half of it is processed, half of it is the SOS. Salt, oil, sugar. If you've heard me speak before, I talk about it all the time. It's that simple. Salt, oil, and sugar. That is the demise of our nation, the world, when it comes to inflammation. This is it. Your body does not break those things down the way that they should. And we are so out of whack with how much we should be having or should not be having. And now there's all substitutes and chemicals in the foods and hormones and on and on. Look at the ingredients. Look at this picture right here. What are the ingredients in the pepper? I don't know, Christine, pepper? Yeah, you're right. How about the onion? Onion, eggplant, eggplant. Okay, yeah, we can break it down into water and this and that, but I'm telling you, there's one thing, right? But if we're going to do stuffed peppers with on and on and on and on, this is where it gets tricky. So with your clients that are suffering from inflammation and extra pain, ask them, how's your diet? What do you normally eat? As a trainer, you should be asking them, like, hey, by the way, what's your normal breakfast? What's your favorite foods? What do you have for like lunches, snacks, dinners? Get them used to telling you. I have a client I've been working with for like, I don't do a lot of personal training anymore, but I've been working with this man for about almost 10 years. And every morning that when I see him at the end of our session, I ask him, and he knows, what'd you have for breakfast today? And he knows he has to answer because he never ate breakfast. And I said, when you get up, you have to get your body going. You need to have something. And I said, I want you to have your protein and I want you to just have something. And I say, you know what, how was breakfast? So what'd you have for breakfast? And he spits it off. And sometimes he'll say, like the other day, he was like, oh, I had duck and asparagus. And I'm like, what is happening? He's like, oh, sometimes I have like a little leftovers. I just have a little something. And he said, the only reason I eat is because I know you're going to ask me. Oh, so he knows this is conditioning. He'll do it now. It's been a routine. This is years, right? He knows I'm going to ask, and you don't want to lie, right? So this is really interesting to think about again. Get that person in the routine, like we just said. Communicate, question and answer. Hey, you had duck and asparagus. Why? That's okay. That's good protein. Like that's okay. You had some vegetables. That's great. Why is that? Oh, well, great talking point. All right. Real life situations, the choices that you have to make. It's not always going to be great. Someone says, oh, Christine, I did so bad. I had this big chocolate chip muffin for breakfast. I'm like, awesome. Did it taste great? Okay. Well, now what? Now let's do some fruits and vegetables. Okay, great. That all of that flour and okay, well, yeah, let's have some extra water. Okay, let's do it. We're not going to feel bad right now. And we're not going to make our clients feel bad, especially with, autoimmunes or inflammatory, anything that's going on. We don't make them feel bad. It's just, okay, listen, you really love the donut, eat the donut. But let's make some other choices and be supportive for that. Provide them with resources. Like I just said, I love, you can go on arthritis.org. You can go on MedFit Classroom and see all of this information. Look at the blogs that are out there. There's so much information that, hey, you know what? It makes me feel a little bit better. There's Facebook groups, there's Instagram groups. You just put in arthritis, and I'm always on there looking at what people are doing. Different recipes are on there as well. And some things work, some things don't. Are you someone who likes shakes or juices or whatever? Super important. If you know someone that has arthritis and you're working with them, show them this webinar. There you go. And once again, at the end of every session, like I said before, talk about it. Do they have any sort of food journaling? One of my biggest pieces of advice with this is when we're younger, right? When you feel, I like to say the word hungover, right? Okay. You know, because the night before you probably overdid it, whatever you did, right? Well, you remember that, but what about the days where you felt awesome? Do you ever go back and think, well, what did I do the day before where I woke up and felt great? Maybe you ate all whole foods. I know when I travel and I go to places, I was just at a retreat in the Dominican Republic. All the food for 4 days was absolutely fresh and grown there, and there was not extra preservatives and this and that. Guess what? Less bloating, less inflammation, feel more hydrated, feel like I have more energy. That doesn't happen for no reason. There's a reason for that. So really talking about the choice and tracking of foods is something you can do. So this is the basics, okay? Please tell your clients every bite you take is either fighting inflammation or feeding it. Processed food fuels inflammation. Real food fuels your health. Okay, and this is my go-to registered dietitian, Stephanie. Um, she is a nutritionist. She is a food psychologist. She is a registered dietitian. Amazing. You should, as a personal trainer or as a fitness professional, have one of these people in your pocket. Okay, she's the girl I call up and say, hey, blah blah blah, what foods are this or this or this, or my client is having a, is really doesn't like this food, but they want, this, and I want to give them some support. That's who I go to. So who do you have in your pocket that you can ask questions, that can give you, she gives me great resources and articles that I pass along to people as well. So again, take a look. You're in the fitness profession. I know there's a lot of people even on MedFit and MedFit Classroom that are in all of the groups that you can reach out to. So basics, cut out processed foods, add in walking, get up every hour, 5 minutes, drink the water. That's it, drink the water. This is how your body gets rid of fat from the cells in the simplest form. All right, we can get into all the science, but it flushes out toxins from the cells like a toilet. All right, flush that toilet. You got to flush it. Okay, really important. Get that water in. And by the way, if you are if you are eating more foods and you're telling your clients, hey, I want you to have the fruits and the vegetables, what are they mainly comprised of? Water, that H2O. So what's going to happen is that, yes, you're going to stay a little bit more hydrated because that water in the cucumber is a little more concentrated, just as if you eat a chia seed and drink water, what does the chia seed do? Right? It becomes kind of like gelatinous, like a kind of, concentrated water, which stays in your body. It keeps you hydrated longer. And by the way, it's still water. It's still going to flush out that system. I know you're looking at me going, wow, yeah, my clients are not going to do this. So what are you going to do? You're going to tell them to start with the SOS: salt, oil, sugar. Have them track it. Salt, oil, sugar. Those are our inflammation feeding big things. Okay? Salt, oil, sugar, SOS. Have a conversation about it all the time. Someone comes in, how's your SOS doing? All right? And this is where it gets good. This is where I'm really, really excited. So exercise and movement, I think once you stop moving, it's all over. So what are the effects of a sedentary lifestyle? On arthritis, we can't just sit. We don't have that benefit, okay? Because now we're dealing with arthritic joints, okay? So a breakdown. And now if we start to atrophy those muscles, it's going to be even worse. So we need to have that conversation of exercise options and realistic expectations. Exercise is medicine. That is a theory, right? Okay, we're going to work with our doctors, but options. If when you were younger, you ran a 2-hour and 50-minute marathon, which is ridiculously fast, now, we're 60, we're 50, we've got arthritis in our joints from overusing for all that time, or an autoimmune, rheumatoid arthritis. We've got to reimagine what exercise means and why. Is it to get a PR or a personal best? Or is it to keep moving and be healthy so I can live independently for the rest of my life? What's my expectation? And when you sit back, okay, you know what? Maybe I don't need to lift super heavy weights, but I still need to lift something. And communicating, educating about diet, right? We did that before. Educate about diet. Well, now exercise explanations. What are the options? What are the expectations we have here? The goal setting, the celebrating. And as we, get towards the end of this webinar, I want to just share with you a couple really easy things that we can do. And what I hear all the time is this: you shouldn't exercise if you have arthritis. Okay? Yep. You know that. I hear it all the time. And by the way, see that big thing up there? Yep, that's your heart. Okay, we need to exercise that. So that's the first thing you say to that's my snap. Yeah, I can't be, yeah, nope. How's your heart doing? Yep, because you need to do something. So this I thought is really important to have up your sleeve. Organ involvement, heart, lungs, eyes. The population is twice as likely to develop heart disease. Okay, and there's even more studies that are out right now. Okay, it has to be exercise. Also helps the lymphatic system. What the heck does that do? All right, the tissues, the organs, rids the body of toxins and waste. We can't have that extra stuff in the body, right? We want to produce cells that fight viruses, bacteria, disease, and strengthen the immune system. So now, if we're talking arthritis that's an autoimmune, our immune system's already compromised. We need to get everything moving, right? So what I like to tell everyone is that if you are a personal trainer, you are going to assess each person individually. But this, from what I've learned, is how to start. Because if you tell people, hey, I want you to do 10 of this and this and this and this, they may not be able to. But what I want to share with you and just give you a little breakdown, we're going to take a couple minutes right now. I'm going to take off the jacket, and I want to share with you what people have been doing successfully. And if you want to join with me, please do. I want to share with you just a little range of motion exercise routine. So I'm going to move this very quickly. And when we think of starting with someone or developing that consistency that someone will do when we're not there, here we go. So first up, what do? Shoulders back, chest is lifted, abdominals engaged. Bring the arms next to the body, and we just stand here for a moment, right? Here it is, the action plan for life. This is what we're doing. We start with the mind. We're going to quiet the mind. Take a deep breath in. And then exhale slowly out the nose or mouth. I want you to do that again. Inhale up. Exhale. Good. One more time. Inhale. And then exhale. Beautiful. Start to roll your head. Just a little side to side. Good. As we do this, I need you to listen. Listen to the neck, that cervical spine. Do you hear it? A little snap, crackle, pop. Okay, as long as the head doesn't roll off the shoulders, you're in good shape. But yeah, you know what? You might feel a little tension. You might feel a little soreness, maybe even a little pain. But we're going to listen to the body. We're still going to move that neck side to side. And I want you to think about any stress or tension you're holding in the neck as you start to release it. Start to clear the mind. Good. Beginning to push away any outside distractions. And then really just focus on the most important thing in the world, which is yourself. Bring your head back to center. And now start to roll the shoulders back. All right, think about how those shoulders feel. Listen carefully. Any snap, crackle, pops, right? Any Rice Krispies. Nice and slow. Good. And then I want you to think about the range of motion right now. Can you add the elbows? Can we open up and press as if we are opening up curtains? I like to say overlooking, a pristine view. All right, whether you prefer the mountains or the aqua blue waters of the Caribbean. Just really opening, and I want you to think about opening those curtains. Good. Lead with the elbows. Open the chest. And now take it a little higher. Reach up. And then exhale, bring it down. Good. Do that one more time. Inhale up. Big stretch. And exhale. Good. All right. Stay right here. Perfect. Now I want you to take your arms and round them, right? Like you're giving a nice big bear hug around a tree. A lot of room between the shoulder blades. Good. And now you're going to open all the way out like field goals, okay? Or like a cactus, either one. Opening the tight pectoral muscles. Do that again. Round it. Good, and then open it. Good, do that again, round it. A little spinal flexion and extension right here. Good, working through the joints. I want you to loosen everything. Inhale and exhale. Good, stay right there. Good, let's bring the arms down, put them right on the hips, and just start to circle the hips just around. Once again, we're listening, trying to get in tune with those hips, okay? All the way around, any snap, crackle, pops, it's super slow. It's like Shakira, hips don't lie, okay? But gotta be aware of this. And we have to teach our clients to listen to the body, especially with arthritis and various joints in that body. And then we're gonna take the hips forward, backwards. Think of the stomach, think of that core as like a bucket of water pouring a little bit out the back, a little bit out the front. Good, just getting that nice range of motion, a little mobility through the hips. You might even hear your knees or your ankles crack as well as you do it. Good. And just take that, bring it right back to center, and I want you to bring one knee up at a time, as high as you can, all the way up. Think of that hip. Good, and now engaging the core. And what I'm gonna do is start to bring one arm in at a time. And this is super slow. Good, we're moving those knees, right? Listen to the knees, snap, crackle, pop. Okay, it's okay. Beautiful. One last time. Good. And then put your weight, I know you can't see my feet, but put your weight on one foot, and I want you to just roll your ankle around just a little bit. And then just switch it and do the other side. Good. And then bring that foot down. I want you to wiggle your fingers, wiggle your toes. Wiggle, wiggle. Good. We're going to open and close the toes and hands, just like this. Good. And then shake everything out. All right, take a deep breath in. Bring your arms up. Exhale, release. Good. Do that one more time. Inhale up. Exhale, release. That's it. That is a range of motion exercise routine. And over the course of the last couple years, I've learned that that is a way to start. Now, you could be working with someone that can pick up heavy weights and is doing all the things. But this is something that we should be doing. We should be assessing our body from top to bottom, from head to toe, all the major joints. I just did that for you right there. But we're having our clients listen and assess themselves each day, at the beginning, at the end, and maybe they end and begin with those deep breaths, puts them in that beautiful conditioned behavior that is going to be a habit. So what I want to share with you, some key takeaways right now. Exercise is crucial if you have chronic diseases, right? For our strength, our flexibility, joint pain. And this is, if we're stiff and painful, sometimes walking or running is like, I can't imagine doing this. But guess what? What we just did is something that is doable. And that's what we have to give people. That's where we have to start. And when I went out and talked to all these people in the last 2 years and all these companies, they were so adverse to starting. And they heard all these scary things. And when we think of the action plan, make it accessible. All right. This is what's going to help us in the long run. And when chronic diseases threaten to immobilize you, it's exercise that keeps you moving. And we need to express that to our clients. So with that said, number one is your mindset. Get people open to doing things. That communication, the why, where are you at? Number two is your nutrition, right? Start with the SOS. Salt, oil, sugar. Can we just track it? Can we talk about it? Can we open up that conversation? Make it a part of the routine. And the third one, obviously, is exercise. Any movement matters. Take some exercise snacks throughout the day. If you can get in an hour a day, that's what I tell people. And they say, I don't have time. But guess what? If you can take 5 minutes each hour, you're going to get an hour in like that. So these are some of the ideas. This is my information, everyone. And I'm just so grateful to be able to bring a little arthritis plan of action for all of us, because it is time to take action. And you are the ones that are out there and have the ability not just to change lives, but to save lives. With that said, my name is Christine Conti. I will throw it back to you, Jonathan, and I'm just so grateful for all of you being that light in the world to go out and help people.
Pull up the panel and ask But there was a really nice comment in there from Linda. Let me check that out for you, Christine, and then we'll jump into any other questions that are in there. If anybody's got any, go ahead and drop them in. We'll just probably grab one or two. We're a little over our normal time. So Linda was saying, I have a relative who has had 4 joint surgeries. She has given up and her daughter cannot get her to move. Her daughter
Mhm.
is frustrated with her. I see the mental depression as her biggest obstacle. Thank you, Christine. This was so helpful. My heart breaks for this woman. And as a fitness pro with lots of my own movement issues, I so want to help her be curious and hopeful. And that really is it right there. What you said is the what you said during your presentation today, the sense of like curiosity and exploration and hopefulness. If you just have a touch of that, it doesn't mean, it's not going to become this rainbows and unicorns experience for everyone, but you got to have that ability to just kind of step outside the comfort zone a little bit. And I think too often, especially in pain management circles, there's an attitude: if it hurts, don't do it. And there's a really important distinction between the pain of hard work and the pain of injury that is lost when we just have a very simplistic, if it's uncomfortable, don't do it approach. So there wasn't really a question in there. I just wanted to share that with you from Linda because I think it gave her some hope that she can help one of her, relatives. Which good luck, Linda, because it's always difficult when we try to reach out to our relatives, right? Because we get hired by people because we're amazing at what we do, but our own relatives somehow it's always maybe
Right.
don't value it as much. Let's see with Patricia has a question. This might be our last one just because of our time, but Patricia says, being careful about recommending nutritional choices. I guess she's asking, that was the nature of the question. I guess she's asking, where do we draw the line as far as making any nutrition recommendations? Go ahead with that one.
It's such a great question because if even if you are a registered dietitian or nutritionist, if you are working with someone as their personal trainer, stick to that. If you are working with them as a registered dietitian nutritionist, stick to that. Like have separate, separate I guess bookings or times or whatnot that you meet. Like we don't want to mix them together. Like, oh, you're lifting weights. Also, let's hear about your spinach intake and your no. But what I do want to tell you is that, and I think this goes for everyone, is you're not, as a personal trainer, writing someone a specific meal plan for them to follow. You're not tracking their macros. You are not, listen, write this down, you are not giving them shakes or pills or selling your multi level marketing to these people, especially if they have arthritis, inflammatory, anything. That is not your job. You are a movement specialist. You are looking at their body, their muscles, their bones, their skeletal system. That's your job. So when we think of what's our place, you can tell people eat whole foods. The research is out there. If there's a research paper that says, hey, by the way, did you know that salt, oil, and sugar, these are the daily recommendations by the whatever, okay? That's really important. Cheer for them for more fruits and vegetables. Cheer for them to drink more water. These are very general. We're not doing anything super specific or telling them, listen, I even say, don't even tell people like, don't eat the donut. No, that's got eating disorder written all over it. Like it's, hey, let's make healthier choices. We're not taking away, we're adding. We're just giving suggestions of whole foods. That's kind of my blanket.
Yeah. So Patricia, I think that's a great way to handle it too. Just stay within scope of practice, keep things general, and let people pick from healthier foods that they enjoy. But also, I think even going a little bit farther than that, I believe that if you're even just a fitness professional, even if you don't have a nutrition credential, if you don't address nutrition on some level, it's a dereliction of duty to your client. Because
True.
if you're a healthy person, you have to have a basic understanding of what healthy food is, and you don't need qualifications to discuss that. Every human being who walks the earth should have like a basic understanding of what good nutrition is. We know that what the earth provides us as close to its in an altered state as possible is going to be mostly good for us in the right amounts and such. So there's a certain amount of it that we have to address, and but staying within that area that and what your scope of practice is always important too. But I think we have to address it almost on some level, but definitely don't mix it in with the weight training. Dedicate some time for that so we can take it
You know
seriously.
what I was going to say, Jonathan, that you reminded me of? Think about in kindergarten, right? In kindergarten, didn't our kindergarten teachers teach us about like fruit and nutrition and apples and like right? and vegetables are
Yeah.
good. They weren't a nutritionist, they were a kindergarten teacher. Yet,
David
why
didn't
do we
scope the
go
practice.
crazy? Like, we get crazy. Like, I think we
Yeah.
overdo it these days of like, you can't talk about, and that, back to kindergarten.
Yeah, it's true. There's a little bit of, I think in an effort to maintain appropriateness, we sometimes over check ourselves in terms of what we can talk about. I think because and I'll just end this with a story. Very early in my career, I was in that bucket. I was like, okay, I'm a certified personal trainer. I can't talk about nutrition, and I tried to not talk about nutrition. And about after the second or third time, a client said to me, "Well, what do you eat?"
Right.
And like you can't not answer that question because you can't say, well, I don't eat food. Like you have to. So that made the light bulb go off. They're like, okay, well, they know that you have a basic understanding of what nutritious food is, at least on a very superficial level. So there's no reason to not talk about that because you're a human being who is, oh, when I eat this, I feel better. When I eat that, I feel worse. Like that's not something that you have to be qualified to teach. But anyway, thank you so much, Christine, for your wonderful content. And it's exciting to see you present. And it's also exciting to see you continuing to do so much good work in the arthritis space and just giving that little message of hope and encouraging people to step outside and just move, or even inside and move and just stay moving. It's so important, like you said. And I just hope everyone took that to heart, that as best as we can, even when people are dealing with painful joints, we have to move as much as we can that doesn't cause pain, because moving less than we need to makes more pain. Moving too much makes more pain too. We need to move the right amount. That's the big takeaway for today. So listen, everyone, thank you so much. Thanks to Christine again. And thank you for giving us your time and attention and energy. We hope it was valuable. Be sure to watch the replay if you want, and check the handout out if you want to go over the notes again. We'll hope to see you again soon on our next webinar. Bye, Christine, and bye, everyone.
Bye, everyone. Thank you.